You know, the pandemic has put so much of life on hold.
One thing that hasn't stopped the need for blood. It's a fact one Maryland family knows all too well, and they want to get the word out, hoping more people will donate.
WMAR 2 News' Abby Isaacs puts their story in focus and explains how you can help.
A national blood supply shortage because of COVID-19 is impacting Betsy Weingarten's mom's quality of life, and she feels like no one even knows it's happening.
I feel like I won the parent lottery, and it's just my turn to give back.
After years as a stay-at-home mom for her 2 kids, it's now Betsy Weingarten's mom's turn to be taken care of. In her 90s, she lives in Ellicott City and is a 2-time cancer survivor.
The great news is she doesn't have cancer anymore, but the bad news is 2 courses of radiation in a relatively short period of time has left her with some damage that's resulted in bleeding.
So last summer, she started needing transfusions.
They allow her to live, most importantly, but also they help with her quality of life.
She says when she needed them, they were readily available. But that started to change at the beginning of this year.
Now her blood levels have to get extremely low, so she has to be in a very weakened state before we can get the blood that she needs.
Weingarten learned it was because of a national blood shortage because of COVID-19.
It's really scary. When your blood levels get too low, it can be a strain on your heart.
The American Red Cross says approximately 1,000 blood drives have been canceled each month nationwide. If you equate that to the potential number of lives saved, that's 90,000 people.
Many of our partners feel compelled not to host in-person drives because they're not requiring people to come to the office to work, or, schools weren't in session.
Misty Bruce, executive director of the American Red Cross of Central Maryland, says another factor is a hesitancy to go out in public.
When they are setting a criteria of things on their list, I think it's natural to say, oh, well, maybe I shouldn't go to the blood drive, not realizing that without that blood, there could be a patient that doesn't get the support that they need.
The blood could go to people like Betsy's mom or to one of the large hospital systems in our area.
We're tight. I'd say the supply is tight, and I'm hoping that it won't get tighter.
Dr. Paul Ness is the senior director of transfusion medicine for Johns Hopkins. He says their blood supply is dependent on the Red Cross. They made contingency plans to decrease blood usage that they fortunately didn't have to use. But Ness is concerned about supply going into the summer, which is always a difficult time, and as we're starting to return back to normal.
Elective surgeries have picked back up. More people are out and about, so unfortunately trauma needs increase.
He says they never have enough blood, but now it's more important than ever to donate if you can. For Weingarten and her mom, it could change everything.
If you want to do something that really makes a positive difference in someone's quality of life, giving blood is a wonderful way to do it. And for folks out there who already are giving blood, I just want to say, as a family member of somebody who's dependent on blood, thank you very, very much from the bottom of my heart.
If you've had COVID-19, yes, you can still donate blood. You just have to be healthy, and it has to have been at least 14 days since your last symptoms. Also, all 3 of the FDA-authorized COVID-19 vaccines have no impact on your ability to donate blood. For WMAR 2 News, I'm Abby Isaacs.
Good information there. Thanks, Abby. The Red Cross is looking for new partners to host blood drives. If you cannot give blood, they are in need of volunteers to support the blood drives. We have more information as well as a list of all the drives happening in our area on our website, WMAR2news.com.